Medical college plays a very important role in doctor's life, whether it is of academic related or it is a whole bunch of lifetime memories. But there are some myths and misconceptions that usually circulates on internet about medical students. Hello everyone, my name is Ayush Mahawar and I am currently second year Mbbs student at Jalen MCH. So the first rumor is no sleep, all time coffee. As a medical student, we have heard it all before. I didn't sleep a single minute last night and take all time coffee. Yes, in medical college there are many nights without sleep, especially in exam times. And to avoid sleep, many people take coffee at night. But everyone has their own way of studying and we can't judge anyone's perspective. But as a future doctor, you need to have a good time management. So the second rumor is no free time in medical college. It is true that there is too much to study in very little time. It's overwhelming and nothing like how it was in NEET. But once you set your priorities and get into a rhythm of studying, sleeping and eating, you will be able to make time for your family and friends. There are many free times in college and besides it, but it depends on you that how you utilize that free time. Maximum students feel this in first year, but by the time passes they already learned how to manage free time and studying. So the first rumor is medical college is survival for fittest. This statement is kind of true, but there is a misconception that getting into a medical college through 20 to 25 lakhs students competition of NEET is very tough. But once you enter in medical college, every student is same and everyone has same potential to qualify the Mbbs exams. So you can pass the Mbbs exams only when you left the mindset that every person around you is your competitor. And also learning from colleagues is very common in college. You have to turn your competition into a company. So better is that to study with friends, and studying for knowledge is more useful rather than studying alone and competing for marks. Because at the end nobody will ask your Mbbs marks and your percentage. People will always ask about your clinical practice and your knowledge. So fourth is a very big rumor that once you graduate you will know everything is to medicine. Yes, this is true. Every medical student thinks same as. But you have to realize that you can't remember each and every pages of these bulky books. Your knowledge and diagnostic skills will improve with your experience and clinical practices. If you want to learn these things, I would suggest you to go each and every clinical posting from your second year. By these clinical exposures, you can learn easily instead of reading a tough language of books. So the number 5 rumor is your social life is over. Students believe that once you enter a medical college, your social life is gone. If you want to do well in studies, you will have less time than you did in college, but it's not nearly as bad as most make it out to be. In first year and second year, you have a lot of time to do such social media things. But as you proceed in third year and final year, the time to do these things decreases. Because the studying for university exams and PG preparation with such huge books like surgery and medicine, and also you have to attend clinical postings in hospital and wards. So at that time you have very much less time to do such things. But if you want to do, you can manage it with your studies. So the sixth rumor is you must have an idea of specialization you want to pursue in future. Most of the students entered in the medical college, they have no idea what they want to specialize. Your many time will be spent in rotating in hospital and wards. This is when then you can get a true sense that what life is like in what specialty and decide whether it's really what you want to do. So it's okay that not knowing in what department you will want to specialize in, because Mbbs journey is very long, and by the time passes and after the practicing in hospital and wards as an intern, you will be able to decide that which specialization department is best for you and what subject you love most. So the next myth, actually it is a truth that you will have to find yourself. Because in medical colleges as a student you may always be insulted by professors and HODs, because some professors are very insensitive and rude. And also you have to develop a habit to tolerate insults, because in every viva and every exam, if you haven't studied much or you don't know the answer, and you have to say sorry, and in return you have to bear all the insults that professor telling you. So better is that don't take these things personally and forget about these things. So the next rumor is you have to study all the day. There is no doubt that there is a lot of content to study in medical college. Your first 2 years of medical college will involve studying of the books before you move into clinical postings in 3rd year and 4th year. But it isn't true. You have to slog all day with your anatomy books and cover all the syllabus. The best way to avoid studying is to study smarter, not longer. Learning from best books and concise notes is better, and how to study correctly is the first action to take when you kick off your medical college journey. So here is some tips to study effectively. First, prioritize your resources. Second, try to understand information, not just read it. Third, practice active recall and speech repetition. Fourth, try study with making flowcharts and diagrams. These diagrams and flowcharts will help you revising the whole syllabus quickly. So the ninth rumor is everything you learn is important. Yeah, it's a rumor. We all have seen these big and heavy books. But the truth is you don't have to learn everything inside them. You don't need to study each and every line that given in the book. Rather than you have to focus on most important topics and most important clinical disease according to your university and your curriculum. So the next rumor is there is no time for friendships. Another myth is that you won't have time for your friends during medical college. The truth is that friends make your college experience more exciting. The memories you make with your friends during college life will stay with you for your whole life. Connect with people who share your interest so you can have people to do things with outside of class. Additionally, medical college can be challenging. Having friends inside and outside medical college can provide you a strong emotional support to help get you through tough times. So this is all about the myths and truths about medical college and students. I hope you like the video. I will meet you in next video. Thank you.